Hello, my name is Joycelyn Lumentang, and I had the privilege of interviewing Cynthia Scott for my nurse informatics interview. Cynthia is the electronics health record, or EHR specialist at my facility, which is the Loma Linda University Behavioral Medicine Center. She's also the nurse educator. Cynthia has approximately 10 years of nursing experience, and she also has her master's degree and her psychiatric mental health nurse certificate. She became a super user for Epic, which is the EHR used at my facility. After becoming certified with Epic, she became an embedded builder, which allowed her to be part of the process in making changes in Epic for my facility. By interviewing Cynthia, I received a detailed perspective on the leading role informatics has in guiding healthcare facilities to provide outstanding patient care. Cynthia explained that improving nursing care at the facility requires the use of informatics. Informatics provides the required tools and information to ensure nurses and the interdisciplinary team can provide high-quality, competent healthcare. The facilities department benefits from informatics data in numerous ways, including the efficiency of patient and provider care and documentation tools. The interdisciplinary team must ensure various standards for patient care components are met, and informatics helps the different parties involved with achieving those standards. The individualized question I formulated for Cynthia was, as a clinical educator and an EHR specialist, how does working in informatics help with the education aspect of your role at the Loma Linda University Behavioral Medicine Center? Cynthia explained how being an active leader in the facility's informatics department enhances the educator role by providing her with a unique perspective in educating nurses. By incorporating information from her informatics role into education for staff, she supports the learning process for staff with data, analytics, and devices. She also has the advantage of being part of the department that develops and implements informatics-related changes, and by being part of that process, she feels more confident and competent in teaching those changes. Information that surprised me during the interview is when Cynthia described the role of informatics in my organization's magnet journey. As an affiliate to Loma Linda University Health, the Loma Linda University Behavioral Medicine Center is a magnet designated facility, and this recognition required numerous efforts from the informatics team. By enhancing the nursing workflow, adjusting documentation, removing unnecessary documentation components, improving patient experiences, and analyzing false scores, Cynthia and other members of the informatics team played a leading role in the magnet designation process. Interviewing Cynthia allowed me to gain insights into my current practices as an inpatient psychiatric nurse. I have a greater understanding that the work nurses complete provides crucial information that can be utilized by the informatics team to enhance the nurse's workflow. For example, the obstacles nursing staff faced in completing the 15-minute safety rounds through paper charting resulted in data. This data allowed the IT department to implement rovers into the facility. Rovers are handheld interfaces that access Epic, and they allow staff to complete the 15-minute safety rounds digitally. This provides real-time data to the IT department so that the quality and safety team can monitor patient safety. I am reminded through this interview that I can serve as an advocate for my practices and my patients in my current position to improve efficiency, accuracy, and safety. The interview with Cynthia will create a positive impact on my practice as a master's prepared nurse by giving me a beneficial insight on how informatics will impact my future role. For example, as a master's prepared nurse, it will be my responsibility to utilize best practices to improve patient outcomes. Data gathered from informatics can greatly enhance patient outcomes when it is integrated into practices and used to address patient care. As a future master's prepared nurse, the interview will also help me by illustrating how informatics plays a crucial role in leadership. Because of their advanced knowledge, master's prepared nurses can hold leadership positions. By analyzing data and seeing trends, informatics enables master's prepared nurses to make decisions, work more effectively with the interdisciplinary team, and identify areas that need development. As I continue on my journey in becoming a master's prepared nurse, I will ensure that the valuable information I acquired from interviewing Cynthia will impact my current practices and my future role as a master's prepared nurse so that I can promote patient care, safety, and outcomes. Thank you so much.